Well, I think it's very self-evident to anybody working in healthcare that research is a fundamental part of the care we deliver to patients. It's a way we can improve care for patients, make sure we're delivering it in an effective way, and also to evaluate and to take on board new treatments which can help and benefit patients. It's the essence of how we improve healthcare. I think it's also important for us as an organisation because it's a way we can ensure we're delivering high quality, up-to-date treatment to our patients and they get benefit from it. It motivates our staff, it attracts high quality people to come and work in our environment because they're challenged by new ideas and evaluating the care they're given. And also I think it's important to our organisation. It undoubtedly increases our income into the organisation, which we can use to increase our critical mass, so there's more people there working both in clinical and research sides. And it also raises our profile as an organisation for healthcare within our local community and also hopefully nationally.
I was going to say, I think it's about making it sort of core business as well, and part of our recognition of that is we have a Hospital Heroes programme which rewards clinical excellence, and it has rewarded clinical excellence in the past. But we wanted to focus on research as well to demonstrate that it was part of our core business as a trust, and also to reward those research consultants and their study teams for the work they're doing in research. So this year we have 4 new research awards as part of our Hospital Heroes programme this year.
I mean, one of the biggest barriers we found to increasing research activity is people's time, because we're all being driven hard in the NHS with clinical activity, quite rightly. And so we had to find ways to make sure that people had the opportunities, the time, and felt rewarded for doing research and could see the recognition of it. So we've tried to incorporate research into people's plans, job plans, to get a shared approach to research and clinical activity so that it's seen as very much one and the same thing. And also even simple things like when we make new appointments, to ask the new appointee what they bring to research in Southampton. So they're very, almost from the day they start, that research is valued in Southampton. So trying to change the culture, and that's also, I think, been a really important element of it. But probably more importantly too is trying to give people the opportunities to do research. So we've had some examples where 1 or 2 individuals have come along with ideas for research which we think have been really exciting, but they needed help, some pump priming. So as an organisation we've been able to give that to them. Obviously we expect them then to deliver the research, and we have targets for them to achieve, but it means that they can get off the ground, and that to me is quite a unique approach to it. Normally it takes quite a long time for people to set up their research programmes and get off the ground, which is, from our point of view, is wasted time, because these are valuable people who could be directing, leading and cooperating in research projects from the word go. And so by pump priming them up front, we've allowed them to do that, and then we can get them to increase their research activity in the future.
Focusing back on the leadership, Christine McGrath is the Director of R&D, and she has really helped drive a lot of this initiative and culture change within our organisation. Within the R&D team itself, we've made some key appointments. We have an R&D communications manager and an information manager, research facilitators who can really take research and act as a supportive department and make sure that we are really driving the research and supporting our study teams. So I think that has been very key for us as well.
Well, I think absolutely you don't have to be a teaching hospital to be involved with a successful clinical research. I mean, research ideas come from clinicians, healthcare workers who see a particular clinical problem. Sometimes they might be stimulated by a patient's comments. And so it's fundamentally the individuals who come up with the ideas by seeing clinical opportunities to develop them. I think it is easier in the current environment we work in as a teaching hospital because we have a critical mass of people, so there's more people to help the research projects. We have a very developed research and development unit which can help and guide people through to ensure that they are able to undertake the research to a high quality and get a successful result. But I think the future lies very much in developing networks. To give you a good example, we have a very strong primary care academic research unit in Southampton, which illustrates that you don't need to be a teaching hospital, but they work in very close collaboration with us, so we can gain the benefit of both worlds. Fundamentally, anybody working in healthcare is aware of the need for high quality clinical research to ensure that we're delivering the most effective, efficient care to patients, that we're able to take on new treatments and technologies effectively and safely. And certainly, I think anybody working in healthcare at the moment is very aware of the drive from the centre to do exactly that. So first and fundamentally, it improves patient care.